Hi, I'm Chad McCluskey. I'm the police chief for the city of Waukee, and we're excited to announce that our department has achieved 100% training for every officer of every rank in crisis intervention team training. It's part of our continued effort to be collaborative partners with our community to maintain a safe and enjoyable community in the city of Waukee. The retired Chief John Quinn started the discussion about a metro-wide crisis intervention team in July of 22. Conversations actually started the first of the year in January of 22 and led to a grant being secured that paid for a co-responder team, which is an officer and a clinician that ride together and respond to mental health calls. Waukee was the first organization in the metro to start the program up. And since then, West Des Moines, Urbandale, and Clive have all come on board with it. The program is truly invaluable because it allows us to have a dedicated team that exists of a police officer who's in a softer uniform and a mental health clinician that are paired together, and they ride around and take a lot of these mental health calls.
My name is Officer Kickbush. I work with the Waukee Police Department. I've been here for almost 5 years now. I'm currently assigned on the crisis intervention team here at the Waukee Police Department. We will respond to about 5 or 6 call type. The call types can vary. I mean, it's all mental health related, so we'll have mental health calls, suicide calls, overdoses, welfare checks, and psych patients. And so again, we just do that direct response to eliminate the patrol aspect and to keep patrol officers back on the street, to keep them where they need to be.
Waukee was the first city to implement the CIT program, and Officer Kickbush and the clinician that rides with him, Melinda, that started the program. They really developed something that is truly a model, not only for other agencies in Iowa, but quite honestly, outside the state as well. People are watching what we're doing, they're seeing how we're handling these calls, and the biggest component of it is that through them working with individuals in mental crisis, they've actually created a situation where a lot of people are able to stay in their homes, not develop a criminal history or charges, because they're able to work through these and mitigate these incidents outside of that just by following up and giving these people resources to help with their struggles. The initial training program for crisis intervention teams is 40 hours, so it's a commitment. They walk through, how to deal with the mental health crisis, have patience with these people, how to talk to individuals going through mental health issues, and just give officers tools in their tool belt to help try to work through that. The reason it's important to have all of our officers trained and the benefit of having 100%, and we're very proud of our department being 100% trained in this, is that it reinstills our commitment to collaborative partnerships throughout the community, especially with regards to mental health and taking care of our community. But the other thing is, within our department, it also reinforces the importance of that training. If we mandate all of our officers go to it, but command staff doesn't do it, then that erodes some of that equity and some of that importance. For somebody who's been in law enforcement for 20 plus years, it's not necessarily new information, but it's good reminders. For me as an administrator, it's a good reminder that we need to have patience with our teams. We need to allow them to work these calls through. There was some discussion in the course about when patrol goes on a call, maybe their supervisor's saying, hey, we need to get you back in service. We got other calls holding up. But what that actually does is that creates a situation where that call can have a negative outcome very, very quickly, because rather than taking the time to work through things, officers are trying to rush to a resolution. The ability to express empathy to people in law enforcement, we're not great on that, and we typically go out, try to solve a problem and return to service.
When you're on patrol, you get in the mindset of, I gotta go to the next call, I gotta go to the next call. As a patrol officer, typically I don't have the time to take someone 30 minutes away to a hospital. These calls, they're not fast calls, they do take a while. And now with this, it's really pretty cool for me to see, because that's my job, that's all I do. I can give that person, if they need 6 hours of my day, they get 6 hours of my day. I think it just goes to show every officer how easy it is. Honestly, it's about the person, it's not a call. You gotta just show up and care for that person, and the sooner you care for them, the better outcome you'll get.
My leadership style is lead from the front. I believe that if I'm not out with the team and they don't see me out in the field, they don't see me, helping on calls, they don't see me attending trainings, you get to the point where, from a leadership standpoint, I've become disconnected with what's going on, which is no good. Builds equity with the team to know that that I'm out watching. I know how things are going. I don't have all the answers, but I'm willing to learn.
It's also kind of nice for me to know that now when I'm not on duty, I know every officer has had the same training that I've been through. Mental health affects everyone. Everyone's got something going on. And I think it's pretty cool on how, especially with this training, for us to be the department that started that around here is huge. It's just setting a standard and a model now for the state of Iowa.
You know, everything that we do is centered around trust and integrity and respect and collaboration with our community. And this is just one more thing that helps us build trust with the community and show them that we are truly community partners. We're here to take care of our community, help our community. It's more than just enforcing laws.